Hi, my name is George Puente. I'm head of the Medical and Regulatory Group for the Japan and Asia region. Every year, millions of people die of cancer. We're beginning to bring medications to treat this terrible condition and improve patients' lives by prolonging as well as improving the quality of life. Normally, we train salespeople to do what we normally do at the company. However, this is the first time we're actually going to be training regulatory people to understand what these medications do, what their potential is, so that you can discuss this with your regulatory authorities. Very unique, and we feel that our investment in this process will be very beneficial to all. I hope that you find this program not only valuable, but very useful in your future endeavors and discussions with the various regulatory authorities. Good luck on this new challenge ahead. Thank you.
Perhaps the most important predictor of response to chemotherapy is a patient's performance status. The overall health of a cancer patient clearly influences outcome. The performance status is a reliable, independent predictor of survival outcome for patients with solid tumors. It is a required baseline assessment in clinical protocols. Performance status assessment is recorded for each cancer patient enrolled in oncology clinical trials at baseline. And this is a unique attribute for oncology trials, as it is not routinely recorded for trials in infectious diseases, inflammatory conditions, or other medical conditions. A performance score of 100 signifies a patient who is asymptomatic and has no evidence of disease. A performance score of 90 signifies a patient who is able to carry on normal activity with minor signs or symptoms of disease. A performance score of 80 signifies a patient who is able to carry on normal activity with some effort. A performance score of 70 indicates a patient who is able to care for himself. However, the patient is unable to carry on normal activity or do active work. A performance score of 60 is given to a patient who requires occasional assistance but is able to care for most of his own needs. A performance score of 50 signifies a patient who requires considerable assistance and frequent medical care. A performance score of 40 signifies a significantly disabled patient, one who requires special care and assistance. Now let's move to the other end of the GI tract, the colorectum. The TNM staging is used to stage colorectal cancer. More people die of colon cancer in Asia than the entire rest of the world. Now let's visualize a colorectal primary cancer on diagnostic colonoscopy. The colonoscope traverses the rectum, the sigmoid colon, descending colon, transverse colon, and ascending colon, and ends in the cecum. As you can see, a lesion has been encountered in the right colon adjacent to the cecum. A diagnostic biopsy is performed and cauterized. In this second colonoscopy, a malignancy is encountered almost immediately at the anal verge in the rectum. In this third colonoscopy, a more subtle submucosal abnormality was encountered. This was biopsied and proven to be a sigmoid adenocarcinoma. Hepatocellular carcinoma, liver cancer, is the most common solid organ tumor globally. It is responsible for over 1 million deaths annually.
This cancer is clearly associated with chronic liver injury, and therefore geographic distribution of HCC closely mirrors that of viral hepatitis. Countries with a high incidence of hepatitis B virus, HPV infection, such as China, Korea, Taiwan, Malaysia, Hong Kong, Singapore, Thailand, and countries of tropical Africa, have the highest incidence of HCC. Areas in which hepatitis C virus, HCV infections are endemic, such as Japan and Italy, also experience an increased rate of hepatocellular carcinoma. Even though hepatocellular carcinoma is generally slow-growing, the majority of patients present at an advanced stage, when most are beyond curative treatment. Small tumors are usually asymptomatic and usually discovered during screening programs or incidentally during imaging performed for other abdominal conditions. Patients with hepatocellular carcinoma are currently being enrolled in a Phase 2 trial with single-agent Sutent in Asia and Europe. Hepatocellular carcinoma tends to be a very vascular tumor, and we are hopeful that this proof-of-concept study will prove that Sutent is effective in slowing growth of hepatocellular carcinoma in patients with the disease. As this slide illustrates pictorially, there are vascular endothelial growth factor receptors which are expressed on the surfaces of tumor cells as well as on the surface membranes of blood vessels which supply a tumor. Another growth factor receptor, called platelet-derived growth factor receptor, is also expressed on the pericytes which surround blood vessels. Pfizer's Sutent targets these multiple tyrosine kinase receptors which reduce growth factor signals for tumor cells to grow. Our ongoing Phase 2 Sutent clinical trial in hepatocellular carcinoma will help Pfizer make a decision whether additional larger Phase 3 trials in hepatocellular carcinoma in Asia are warranted. Response of a tumor to any oncology drug given to a cancer patient during a clinical trial requires an accurate, reproducible method of assessing whether the drug changes the size of the tumor.
There is a generally accepted standard with which tumor response is evaluated. That is the RECIST criteria.
Determination of anti-tumor efficacy is based on objective tumor assessments using the RECIST system of unidimensional evaluation. At baseline, individual tumor lesions are categorized by an investigator as measurable or non-measurable. Measurable is defined as those which can be accurately measured in at least one dimension as at least 2 centimeters or greater in size using conventional techniques such as MRI or CT, or 1 centimeter or larger in size using spiral CT. CR, complete response, is defined as the disappearance of all target lesions. PR, partial response, is defined as a greater than or equal to 30% decrease in the sum of the longest dimensions of the target lesions. PD, progressive disease, is defined as a greater than or equal to 20% increase in the sum of the longest dimensions of the target lesions. SD, stable disease, is defined as neither sufficient shrinkage to qualify for PR nor sufficient increase to qualify for PD. Each Pfizer Oncology protocol uses this RESIST classification to evaluate tumor response, as this is a generally accepted classification worldwide. Here is an example of a tumor which has responded to tisalimumab on a Pfizer protocol with a partial response. You can easily see that the longest measured diameter of the tumor has reduced in size by more than 30%. This would be scored as a partial tumor response to tisalimumab.
You should also be familiar with CTC, Common Toxicity Criteria, in evaluating adverse events in oncology clinical trials.
CTC are graded by severity, that is, grade 1 through grade 5, with 5 being most severe. This adverse event reporting is used in all Pfizer Oncology protocols, and also is a generally accepted global standard for cancer clinical trials. Common adverse events often seen with cytotoxic chemotherapy are related to collateral damage due to killing of dividing cells. This includes myelosuppression, including leukopenia, low white blood cell counts that can predispose to infection, thrombocytopenia, low platelet counts that can predispose to bleeding, mucositis, ulcerations in the mouth or esophagus, diarrhea, vomiting, fatigue, dermatitis, among other adverse effects. One must remember that cytotoxic drugs are meant to target cycling cells, and they do so indiscriminately, so normal cycling cells, such as the bone marrow or lining cells of the mouth, might be affected. Such side effects can be treated symptomatically because if inadequate doses are administered, cycling tumor cells will not be affected, and the tumor will grow in size and progress. Thus, for each course of treatment, oncologists may alter drug doses and titrate drug doses based on blood counts or extent of diarrhea and mucositis to achieve the proper balance between tolerable side effects, with a goal of achieving tumor shrinkage in the individual patient.
Last but not least is the cancer that accounts for the most number of deaths globally and in Asia, lung cancer. The first bronchoscopy is normal. Note the abnormal bronchoscopy on the left. The right bronchus is completely occluded with a visible mass, which was biopsied and diagnosed as a carcinoma. Treatment will depend on stage of disease using the TNM system for lung. Over the next year, as you interact with your respective regulatory authorities to gain approval for Sutent and later other oncology agents from Pfizer, I hope you will remember this presentation, because behind every written report are patients who were diagnosed, staged, managed, treated, enrolled on study, evaluated via RESIST and CTC criteria on various Pfizer clinical trials. We look forward to working with you to assist you in whatever way we can to help reduce the burden of cancer suffering among patients in Asia.